Here we offer external audit services. What sets us apart is that this service is offered as an educational consultative service. During the process, we will educate you along the way about the documents that we request, so in the event of a HRSA audit, you know what they're looking for. Typically, our audit service takes about 4 to 6 weeks from the time that we receive all the documents. During the review of your entity, we'll review your contracts with your contract pharmacies, as well as doing an optimization of contract pharmacies that you may be able to add to your program. We will look at your authorizing official and your primary contact to make sure that those are correct. We'll check your contract pharmacies against your contracts and make sure that the data on your contracts is correct and that it matches OPACE. We'll also review your grantee site information to make sure that it matches the HRSA's electronic handbook. Another common finding in HRSA audits is duplicate discount. During our review, we will review 100% of your claims, as well as your Medicaid billing forms if you carve in. Diversion is another common finding in HRSA audits. During our review, we will check all your claims for diversion when it relates to eligible providers, eligible locations, and having audible records for those claims. During the process, if we do discover findings, we will work with the entity to get those corrected. So in the event of a HRSA audit, those will already be corrected. The goal of our external audits is to prepare the entity that they are confident in the event of a HRSA audit.
An important point to know is that the HRSA auditors will actually be reviewing your policies and procedures and taking note of what it is you say that you're doing within your organization. And the audit will hold you accountable to what you say you are doing. So as part of our annual external audit, we will go through and review in detail what it is you have described in your policies and procedures and make sure that that actually matches your practices. It's very important that you're not over-promising how your 340B program is operating. You want to have a compliant program, but if you are promising to deliver on standards that you are not able to do, you may actually set yourself up for a very difficult time in a HRSA audit. Having an annual audit conducted each year is a great time for your health center to learn about what's going on in HRSA audits. Our team is able to give you updates on what we're seeing in the most recent audits with the HRSA auditors and tell you about new trends and new developments that have happened over the last year. It's really important for you to understand the way that HRSA's audits are operating so you can be best prepared in the event you're selected in the future. Another benefit of the annual external audit is it really helps you prepare for what it's like to be in a HRSA audit. So you'll go through the process of pulling all of the data and gathering your contracts, your policies and procedures, having those all in one place. And this means that when you get pulled for a HRSA audit, the experience is going to be a lot less stressful. The annual audit is a great time to receive one-on-one education about the 340B program. Our team makes sure that you understand what are your legal requirements and what are HRSA's expectations. Those are two very different things. Within the 340B statute, there are very specific requirements that are set out. Those are the covered entity's participation in the program and diversion and duplicate discount. Diversion being we only sell 340B drugs to patients of the covered entity, and duplicate discount that we do not offer a 340B discount at the same time that a Medicaid rebate is received. Outside of the covered entity requirements and diversion and duplicate discount, the Office of Pharmacy Affairs also presents to covered entities a lot of expectations of the program through guidance. These do not have the same legal binding authority that the information in the statute does, which was the diversion and duplicate discount. So it's really important for covered entities to understand where they are regulated by the Office of Pharmacy Affairs and where the Office of Pharmacy Affairs expects the covered entity to set up their policies and procedures to align with the 340B program intent. So our team will help you understand the difference and set your program up in a way so that you can be successful in your operations and comply with the Office of Pharmacy Affairs expectations.
Having an annual review of your program is the best way to ensure that you are ready for a HRSA audit. During the review of your 340B purchases, we will request that you run your historical purchase report from the 340B PVP website. This shows us if you have any accounts that you are unaware of where you've been purchasing 340B drugs. During the review for duplicate discounts, we also look at your Medicaid billing form. We look at these forms to ensure that you are using the correct modifiers as well as the correct NPI number. During the review of your entity, we will check OPACE Medicaid exclusion file to make sure that all your grantee sites' NPIs are listed if you do carve in. It's common that we find inaccuracies with your Medicaid exclusion file. When we do discover these findings, we're able to work with your billing staff to ensure that these are prevented for the future. One thing I would like to note that during the review of your audit, we do request a prescriber list. It's important to note that your prescriber list start and termination date should reflect the dates that they had access to the electronic medical record. During the review of your policies and procedures, we will look at the elements that HRSA look for in the data request list. If we do find that those elements are not present in your policies and procedures, we will provide you with templates to help you to update your policies and procedures.
For some health centers, external audits can be a little scary because you're used to an audit being something that penalizes you for something that you've done wrong. But in the 340B space, an independent external audit actually is there to help you. It's a consultative experience. We're not there to report on anything to anyone outside of your organization. Our report solely goes to management. And it's a great area for you to improve on things that you may not be doing. So you may have some issues with compliance. You may have things that aren't going the way they really should be. And so it's a great opportunity to have someone who knows what's going on come and look at that, review that, and give you consultative feedback. One thing that's important for our team is to make sure that we are a trusted resource for community health centers, particularly when it comes to audits. So if at any time you have any questions or want to reach out and discuss that, feel free to reach out to our team at FQHC340B.com.